to make a few brief comments before we turn it over to Jerry and Pam, but I appreciate you guys being here this afternoon. As everyone knows, the past few weeks have involved an intense effort on behalf of federal, state, and local officials to combat the impact of COVID-19. I would also like to recognize our staff here in Lenoir County government for their outstanding work in responding to this event and their continued efforts to mitigate its effect on our community and protecting the health and safety of our residents. I'd especially like to recognize Pam Brown and the Health Department and Jerri King and Emergency Services for the fine work they're doing to protect the folks here in Lenoir County. As you know, this is our first case as of yesterday, and I'm sure will not be our last. But as you guys know, in Lenoir County, we faced a lot of natural disasters over the years and emergency events before, and we have successfully faced those challenges, and we will continue to do that, and we will work through this event as well. We do ask our residents to please remain calm as we go through this process. Please continue to be diligent in following the recommendations of the CDC, of the North Carolina Department of Health and Human Services, and the County Public Health Department as we work through the COVID-19 event. What we do locally, as Pam will share, will ensure that we can have the greatest impact here locally to minimize the effect of COVID-19 in Lenoir County. So with that, I'll turn it over to Jerry.
No. We're going to go ahead and have you no big question right now.
Oh, I'm sorry.
Questions for Mr. James right now, please.
What can you tell us about this case in particular and maybe how it originated?
Well, obviously we can't share much at all about the patient themselves. So the main important thing is that the person was quarantined as soon as they were tested, and that was important. So they are at home recovering, but any personal information obviously we're not able to share.
Can you tell us whether it was related to out-of-state travel or out-of-area travel?
It was related to, I believe, out-of-area travel.
Can you tell us if you guys are doing tracking? Are you seeing who they came in contact with or anything like that?
Pam can go into that, but that is being handled by the health department. Yes, ma'am.
We've seen a couple of counties here in Eastern Carolina, a couple of towns as well, go to the shelter-in-place declarations, proclamations. Is that something that Lenoir County is considering?
There's no plans at this time to do that. Obviously, we're evaluating all options as we follow the lead of the governor with a lot of efforts that he is doing, but at this time, there's no conversation around doing that.
Okay. Thank you very much, sir.
Hi, I am Jerri King. I'm the Director for Lenoir County Emergency Services. And pretty much for our department, we are still conducting our normal business between our E911 Center, our EMS division, as well as our Fire and Emergency Management division. What has changed for us is just our responses to certain types of calls based on the North Carolina Office of Emergency Medical Services protocols that they send down to all EMS agencies. Our 911 center also does emergency medical dispatch, which means that they are part of that EMS system. So there are criteria in which they are questioning patients depending on specific complaint types, and based on those, they will dispatch EMS if it's a high-risk call. They will let the EMS responders know that, and they will, when the EMS responders arrive on scene, at that point in time, they will also ask questions, and if they feel like that person is a high-risk patient, then they adjust their personal protective equipment that they wear. And all that is based on protocols sent down to us by the North Carolina Office of Emergency Medical Services. But other than that, we are answering regular 911 calls and responding to regular EMS calls. So for us, it's business as usual.
Okay. Questions for Director King?
Okay, thank you.
Very good.
And I'm Pamela Brown. I'm the Health Director for the Lenoir County Health Department. And of course, as you know, we announced our first case yesterday. We were wanting to put that off as long as possible. It would have been great to put it off forever, but we do have that case. I'm really pleased that this case was a traveler that we had been monitoring. So they had already put themselves into an isolation situation, and so that means that we had some extra community protection. I will share that at this point, with just having one case in Lenoir County, we are still keeping up some of those initial activities that health departments do when you first get into a situation like this, where we are still doing some monitoring of folks that we feel that need to be monitored, maybe because they traveled, or maybe they have certain symptoms. We also are trying to do some limited contact tracing that we feel will make a difference in the community. But as you've seen over the past few weeks, North Carolina has been shifting those public health strategies that are implemented. So you started to see some of those additional measures. So initially, when we get into a response like this, we do try to really contain it by doing that monitoring and that contact tracing. But eventually, especially if you're in an area with community spread, those measures are not as impactful for the public. They don't make as much of a difference. And so you've seen North Carolina, including our community, move into some of those other measures like that social distancing, or the please stay at home unless you have something very critical that you need to do.
Okay, questions for Director Brown?
Where is public testing available?
So right now we are referring people to their provider because there are some providers in Lenoir County that are providing testing. There are some that are not, and so the health department is trying to keep a handle on who is doing what. And so if we need to, we can refer somebody to a diagnostic center, or refer them to one of the providers that is providing testing. And in a rare case, we can do testing also through the health department if that's needed, if we don't have another means to do that.
Approximately how many tests have been administered?
It's really difficult for me to put a number of tests. Again, if you look at the legislative or the executive changes that have happened, we've put in a plan where positive cases have to be reported to the health department. But some other things, especially as we move into some of these other public health protocols, we don't necessarily have to have people report to us if they're conducting a test. We are trying to partner with the local providers to keep a handle on that number. So I can tell you that at this time, the health department is monitoring about 35 folks.
Can you maybe talk about the status of test kits? A lot of areas are struggling to have enough. The number of cases. Can you just talk about more counties?
Right. Well, I can say this, that when they brought online some of the private labs, so when the testing is able to be done by other than the state public health lab, that opens up a much more capabilities. And so the health department, we still get our lab tests from the state lab, and we just got a new supply in today, for example. And these are things that not only we can use, but we can share with partners. So we have the ability to augment if there is a shortage with another provider in the community. We can help out with that need.
I don't know if you're going to talk about maybe how long it took you guys to get the results for this test. Some people are waiting more than a week now because of a lot of stuff backed up. Can you talk about that as well?
It really does depend, and I know that that's probably very confusing, but when things were sent, and early in the response to this, even before North Carolina had a test or a case, and early in North Carolina's response, there were no state public health labs that could do the testing, so everything went to the CDC. In the CDC, of course, this was novel, it was new, there was a very fast turnaround, but obviously as you start to get more cases, you need to get more testing capabilities. So the state labs of public health came online with the CDC to do testing. And then a couple of weeks ago, more of the private labs came on board to be able to do the testing. Well, everybody has their own kits, their own protocol, their own procedure, their own client list, their own capabilities. And so now we're pretty much telling people that if you've been tested, you should have the results usually between 1 and 7 days, which I know does not sound very comforting, but irregardless of a test result, if somebody is symptomatic, they just need to stay away from others. You don't need a laboratory confirmation to know. It's just a good practice. If you don't feel well, just stay away from others. So that's the guidance, whether you have a positive test, whether you have your test results back, whether you're waiting for your test results. We just want people who are having symptoms to isolate themselves from others.
Chris?
I was just going to say, do we have, throughout the county, to your knowledge, do we have enough testing kits should this transcend beyond one person? Should community, should they share it with each other? Do we have enough testing kits in place for Lenoir County?
Well, I can answer that in two ways. Number one, I have not heard of any shortages, and again, we just got resupplied. We just got resupplied today with the testing kits that we have. But I think the other thing to remember is that, especially as we progress through this, that at a certain point, testing is really not, widespread testing is really not going to give us anything that we need to necessarily help the public. So I guess if I could use something that's maybe a little bit more common, usually we see our flu season pick up around October, and we see it drop off about March. So at the beginning of the flu season, there's lots and lots and lots and lots and lots of testing that goes on because we want to know, okay, do we have H1N1? Do we have H3N2? Do we have B? What are we seeing in the community? And then after a while, you kind of understand, okay, this is really what's happening in the community, and testing starts to drop off. Because at that point, if somebody presents to a provider and they've got all of those common symptoms, they're like, you know what? We're going to treat you like you have the flu, even though we don't have a test result back. So testing is really great up to a certain point, and then past that point, it's really, hey, you know what, it sounds like this could be something that you have. Stay away from other people. Treat yourself at home, because most people with COVID-19 are going to have mild symptoms, and if something pops up and your symptoms change or they get more severe, then get yourself more engaged with the medical system.
I have a follow-up question, if that's all right, to that. So there's been a lot on Twitter and things like that about different things people can do to treat should they have mild symptoms, and I'm not going to get into the whole thing, but what do you recommend for the people who do have a mild sickness? They don't necessarily feel bad enough to go to the doctor. What should they be doing?
Well, I tell you, the folks that are in that category are a critical piece of what we're doing right now. And so really, if it's something that can be managed at home, something that you maybe normally would not talk to your provider about, if it's very mild symptoms and you're thinking, oh, I don't feel very well, so I'm just going to spend the day in bed and watch TV, that's what we want your plan to be. So people who are having those mild symptoms, again, over-the-counter remedies, maybe to reduce a fever or reduce a cough, are great things to have on hand, but just treating at home. Now, there's no harm in touching bases with your provider. There's nothing wrong with that, just to kind of put it on their radar should something more significant start to happen. But in this case, if you're having some mild symptoms, to go out of your home and into a healthcare setting may expose you to something, or may expose others that you're around to something as you're waiting to get care. So really the safest thing for you and others is if those symptoms can be managed at home, just stay home and manage those symptoms.